Apparently my review is over 15 minutes, so it shuts off. So to not stress anybody out, it was just a few more minutes left here. The last would just to make sure you understand the structures of the heart. We went over this, make sure you know where the heart is located, where you would listen to different areas of the heart, any age-related changes within the heart that are normal, pulse amplitude, capillary refill. I mean, all of your assessment of the cardiac system you will need to know. Very little, if really any, on the lymph system. So I wouldn't concentrate on that. Somebody asked me that in an email. Yeah, there's not a question on here. And then the JNC8, this is just so that you understand blood pressure guidelines. And really, it's even getting more strict. I think I had already spoke about this, but we started to do these guidelines with diabetes, and a lot of times people weren't even having the conversation that a patient had diabetes until they were well into diabetes with a high A1C. And now they kind of start the conversation, and actually a lot of times medication gets started when you are impaired glucose, or when you're kind of pre-diabetic. So same thing with hypertension now. So, they kind of gave these guidelines, and then, kind of tell you when to start medication. But what we were finding is that people were taking those numbers like 150 over 90. And if somebody was 92, they'd say, oh, okay, well, you're all right. You're just about there. So, come see me in another 6 months. And if you're higher, we'll do something about it. Well, no, they're actually trying to make it more strict so that these conversations about diet and exercise changes and possible medication start earlier. So these are probably going to be changing soon. But just to understand that there are guidelines out there that kind of tell us from the research how we should care for our patients. So the auscultation assistant, the heart murmur, heart sounds and murmur, just dive into that. Oh yeah, just know your definitions and make sure you can apply a normal, just applying what you're hearing, and when understanding the normal health assessment, so that when you do hear something abnormal, you're aware that whether or not this is something to be worried about or not worried about, or whether this is a new change or an old change. Or an old finding. So 50 questions. You will have 60 minutes. There will be no calculator. There is no backtracking. You will have 15 minutes when you're done to review only the questions you got wrong. This will be the same setup going forward. So that is it. You have me to kind of guide your discussion questions. If you want to ask more questions here, if you want to ask some questions here about the exam review, I will be present both Thursday and Friday, but I am at a global nurse conference this upcoming weekend, presenting about Mississippi, so I won't be in Blackboard. So if you're asking me questions on Sunday night, I'm not back in the classroom until Monday morning, which it might be a little too late for some of you if you don't have an answer to a question. So study hard, rest up, eat nutritious meals, go for a walk, and I look forward to seeing how well you guys do. But do know this is if you don't like the cardiac and the respiratory system, this will be a hard exam for you. But if you can start to memorize and apply the information from health assessment, you should do fine. All right, you guys can do it. I believe in you.